Ginger is a popular spice with a long history of use in traditional medicine for its potential health benefits. It is commonly used to aid in digestion, reduce nausea, and reduce inflammation. However, there are certain medical conditions in which ginger may not be suitable or may even be harmful. So here are some medical issues to consider if you are thinking about incorporating ginger into your diet. Number 1. Bleeding disorders. Ginger has a blood-thinning effect, which means it can help prevent blood clots and may lower the risk of heart attack and stroke. However, this effect may also increase the risk of bleeding in people with bleeding disorders, such as hemophilia. Hemophilia is a rare genetic disorder that affects the body's ability to control bleeding. People with hemophilia have low levels of clotting factors, which are proteins that help the blood clot. As a result, they may bleed for a longer time after an injury and are at an increased risk of spontaneous bleeding, especially in the joints and muscles. So if you have a bleeding disorder, you should avoid ginger. Before we proceed, please take a moment to subscribe to the channel and hit the bell icon. If you find our videos helpful, please support us by becoming our patron. Number 2. Pregnancy. During pregnancy, it is important to be cautious about what you eat and drink, as some substances may be harmful to the developing baby. While ginger may be safe to consume in small amounts during pregnancy, it is not recommended to use large amounts of ginger during pregnancy. Ginger may stimulate contractions and increase the risk of miscarriage, especially in the early stages of pregnancy. Some studies have found that ginger may be effective in reducing nausea and vomiting during pregnancy, but more research is needed to confirm this effect. However, it is always best to go on the side of caution. So, avoid consuming large amounts of ginger during pregnancy. Number 3. Surgery. As we already told you, ginger has blood-thinning properties. This property of ginger may also increase the risk of bleeding during surgery. Before surgery, it is important to follow your healthcare provider's instructions on what medications and supplements to take and avoid. Ginger may interfere with blood clotting and increase the risk of bleeding during surgery, so it is generally recommended to stop consuming ginger at least 2 weeks before the procedure. Even after surgery, it is generally recommended to avoid ginger for a period of time. Number 4. Gallstones. Gallstones are hard deposits that form in the gallbladder, which is a small organ located in the abdomen. They are made up of cholesterol, bilirubin, or other substances found in the bile, a fluid produced by the liver to help digest fats. Ginger may stimulate the production of bile and increase the risk of gallstones in some people. If you have a history of gallstones, you should use ginger with caution or avoid it altogether. Number 5. Heart conditions. Ginger is known to lower blood pressure. Although this is a good thing for people suffering from hypertension, what if you are already taking medication and your blood pressure is within normal range with those medicines? If you are taking blood pressure medications, ginger may interfere with their effectiveness and cause your blood pressure to become too low. This can be dangerous and may lead to symptoms such as dizziness, fainting, and an increased risk of falls and accidents. Remember, you shouldn't stop taking your blood pressure medications without the approval of your healthcare provider, as this can be dangerous and may lead to serious complications. Ginger may be a useful addition to your blood pressure management plan, but it should not be used as a substitute for medications. Number 6. Diabetes. Some studies have found that ginger may have a blood sugar lowering effect, which means it may help lower blood sugar levels in people with diabetes. As for hypertension, the same goes with the medication used to lower blood sugar. Ginger may cause your blood sugar levels to drop drastically. This condition is called hypoglycemia and is even more dangerous than high blood sugar levels. It's also important to know the symptoms of low blood sugar levels. So if you feel extremely hungry, are sweating profusely, have a fast heartbeat, and are feeling irritable and sluggish, you might be suffering from hypoglycemia or low blood sugar levels. So if you are taking medication to lower your blood sugar, you should use ginger with caution. And again, to be on the safe side, you should avoid using ginger in such conditions. Number 7. Allergies. Some people may be allergic to ginger and experience allergic reactions after consuming it. Symptoms of a ginger allergy may include hives, rash, swelling, and difficulty breathing. If you have a history of allergies, you should use ginger with caution or avoid it altogether. It's also worth mentioning here that diseases like asthma and dermatitis, which is a condition of skin, are also due to the allergic response of your body. So if you have asthma or dermatitis, you should avoid ginger. If you experience any allergic reactions after consuming ginger, you should stop using it immediately and seek medical attention. An allergic reaction can be a serious condition and may require treatment. Number 8. Stomach ulcers. You'll be surprised to know that ginger has been traditionally used as a digestive aid and may have some potential to help reduce the risk of stomach ulcers. Now that's contrary to what you were expecting, isn't it? Wait a minute and let us explain this one. Ginger reduces the risk of developing stomach ulcers. But what if you already have them? If you have stomach ulcers and consume ginger, it may irritate the stomach lining and worsen the symptoms. So if you have stomach ulcers, or if you have a history of stomach ulcers, you should use ginger with caution or avoid it altogether. Number 9. Liver disease. Although ginger is good for most people, but not for the people who have liver disease. Ginger may interfere with liver function, so it's not suitable for people with liver disease. Also, people with liver disease are more likely to have stomach, duodenal, or esophageal ulcers. These ulcers bleed profusely once the disease has progressed to a certain level. As we already told you, that ginger increases the bleeding time, so it should not be used by people with liver diseases. So if you have liver disease, avoid ginger or use it with caution, and under the supervision of a healthcare professional. Number 10. Are you trying to gain weight? Ginger has been used in weight loss diets for a long period of time because of its properties like appetite suppression and making you feel full. But that's good for people trying to lose weight. What if you are trying to gain weight? What do you think the effect of ginger will be? First, ginger is a low-calorie food. That is not likely to contribute significantly to weight gain on its own. Second, you'll feel full and won't eat much, which is required for healthy weight gain. So either way, eating ginger when you are trying to gain weight doesn't seem like a good idea. In conclusion, ginger is a popular spice with potential health benefits, but it may not be suitable or even be harmful for people with certain medical issues. If you have any of the medical issues that we mentioned in the video, you should either avoid ginger or use it with caution and under the supervision of a healthcare professional. It is always best to consult with your healthcare provider before incorporating ginger into your diet, especially if you have any underlying medical conditions. Thank you for watching the video and subscribing to the channel. See you in the next video.